Hi, this is Sarah Reese from Polk County Public Health here to provide you with a COVID update. Recently, you've heard Commissioner Malcolm talk about isolation and quarantine. These have become pretty common topics as of the last several months. Both isolation and quarantine are measures that are important tools that we use in public health to slow the spread of disease, especially for COVID-19. While a 14-day quarantine period has been recommended for the greatest protection, last week the Center for Disease Control and Prevention, or the CDC, announced an update to this long-standing guidance. With it, brought the CDC's recommendations and consideration of risks and benefits for sticking with the 14-day quarantine versus shortening it, and they did this considering certain conditions in mind. The evidence shows that the risk of a person in quarantine becoming infected is highest in their earliest days of their quarantine. Shortening the quarantine period by trimming off the last few days when the risk is much lower makes people more likely to follow the guidance, and it also means fewer disruptions for our lives. I'd like to take a moment to walk through the 14-day quarantine period as it has been long-standing, and also to describe the options of the 10-day and 7-day options to give you a little more information about its potential impact for your situation. So I'm going to call your attention over here to the 14-day quarantine period. So when we're talking about quarantine period, this is for individuals who have had an exposure to someone with COVID-19, who would be considered a close contact. When we're trying to figure out the 14-day or whether we use the 10 or 7-day option, we always use day 0 as the last day of exposure. So if I was with Johnny on Friday and Johnny becomes sick, my last day of exposure, or my day 0, would be Friday. When we look at the 14-day quarantine period, this is the safest option to prevent the transmission, and is definitely been acknowledged by the Centers for Disease Control, MNDH, as the top recommendation for COVID from a science perspective. We also know from a behavioral science perspective, there are a few other options that now can be considered. So for the 14-day quarantine period, there are 3 still types of settings where the 14-day period is recommended in the state of Minnesota. Those are household members, congregate living, and healthcare settings. So for anyone in this scenario, the 14-day guidance remains the same as it did for weeks and months prior to now. Now we're going to look a little bit closer at the 10 and the 7-day guidance. I will review this guidance with saying that there's lots of little things to consider. So the Minnesota Department of Health has a wonderful guidance document that you may also reference to help you figure out what your situation is, and we certainly can be available if you need assistance. So to meet the shortened guidelines for the 10 or the 7-day criteria, there are a few important things that I want to call out. This would be for someone who's a close contact in a social setting. So that could be at school, it could be at an event like a funeral or a wedding. It could also be from another type of social exposure. It is different than a household exposure. So to utilize the 10-day or the 7-day quarantine period, it needs to have been a social close contact. The individual needs to have no symptoms, so you need to be well. We call this asymptomatic, or presumably feeling well. This criteria does not require a test, so no positive test. No one in the household can be positive for COVID, and we would want to point out that it's important to continue to watch for any COVID-like symptoms through day 14. And then looking closer at the 7-day option, again, this mirrors that it would be coming from a social setting. The close contact would have had their last day of exposure to someone who has COVID-19 in a social setting. The person would have no symptoms, continuing to have no symptoms. How this differs from the 10-day is this individual would have a negative COVID-19 test result. So there are a few important details regarding the negative test result as well. Number one, that test needs to have been collected on or after day 5 of exposure. So remember, again, day 0 is the last day of exposure. And also, to end the 7-day quarantine period, you must know the result. So just because you had your test collected on day 5 or day 6, if you don't receive your result back, then we would ask you to continue separating yourself from others until you get that test result back to ensure that it is a negative result. And similarly to the other situations, we would want to ensure that no one in your household has tested positive for COVID and that you would continue to watch for symptoms until day 14. While this is a lot of information to digest, we understand that there's lots of different scenarios that people are presented with. And so we encourage you to take a look at the Minnesota Department of Health website for further guidance. Thank you and have a great day.